Hi, I'm Allie.
And I'm Becky.
We are registered dietitians that are passionate about food as medicine, and we take a functional approach to whole body health.
In this video, we are going to be talking about osteoporosis and bone loss, as well as 5 tips and foods for prevention.
Yes, osteoporosis by definition is literally porous bones or bones that are thinning in their density. This yields a higher risk for fracture or break of the bones. In fact, we see 1 in 3 women will experience a bone fracture within their lifetime. This leads to debilitating pain, which accelerates the aging process, increases risk of mortality, and can be quite expensive hospital bills.
Okay, so let's go ahead and cover why women are at higher risk, as well as why that risk is going to increase with that aging process.
Yes, so estrogen actually plays a huge role in the bone resorption process, or the way that bone is regulated. And we see that as estrogen levels fluctuate, we can often see bone loss. This can occur in women with pregnancy when they're growing a bone structure for their baby and they leach calcium from their bones, or through the breastfeeding process. And this can also be a risk factor, maybe even more so, with perimenopausal or menopausal women as their estrogen levels significantly decline. We also know, just with generalized aging, we tend to see more sedentary lifestyle, less muscle mass, and less weight-bearing exercise. This can play a huge role on bone loss risk. We know that stress and toxins can be contributors, as well as medications, both over-the-counter and prescription. We see nutrient deficiency, as well as a low nutrient-rich diet. And we especially want to watch out for those diets that are high in processed refined foods and refined sugar.
Yes, in fact, with diet, there is a 2.5 times greater risk of frailty or fragile bones, essentially, when we're consuming added sugar. So looking at those that consumed 36 grams of added sugar in the diet versus those who consumed 15 grams.
Yes, another argument for our Mediterranean or food as medicine approach to the ketogenic diet. Not only does that support bone health with those less refined sugars and watching carbs, but we're also going to prevent dysmetabolic syndrome, cardiovascular disease, and diabetes.
So the first thing that I always recommend when it comes to prevention of osteoporosis is going to be weight-bearing exercise and pairing that with post-workout recovery, specifically a smoothie with grass-fed whey.
Yes, so we actually start to experience sarcopenia, or muscle wasting, associated with aging. In fact, women, once they hit age 30, lose 3 to 5% of their muscle mass per decade. There's an intimate connection of muscle mass and bone health. So when we do weight-bearing activity and resistance training, that muscle gain and pressure on the bone actually increases our bone density and prevents osteoporosis. What's more is we've seen in this research study that perimenopausal women, independent of exercise, increase their muscle mass by using whey protein powder. The amount of leucine in whey supports lean body mass, which can boost metabolism and help bone health. What makes our naturally nourished grass-fed whey superior to a standard whey protein powder is that it's sourced from grass-fed cows and that it is non-denatured. This low heat extraction process retains antioxidants as well as immunoglobulins to support immune health, and it contains specific compounds for bone health. Milk basic protein has been shown in studies to actually support osteoblasts, aiding in bone building, inhibit osteoclasts, reducing bone cancellation or breakdown, and supporting bone mineral density.
Okay, and next up we want to focus on vitamin D. So vitamin D deficiency is specifically associated with risk of osteoporosis. Now that vitamin D is going to aid with calcium absorption, and we want to pair vitamin D always with K2, which is going to direct that calcium and tell it where to go, preventing things like kidney stones or calcification of the arteries. We want to focus on things like wild salmon that are a natural form of vitamin D. We want to focus on getting out in the sunshine at least 20 to 30 minutes a day without blocking, our eyes with sunglasses or wearing full protection or sunblock for some of that time at least. And then supplementing with a D3, K2, such as our vitamin D balance blend. Now the capsule is going to be a 5,000 IU dosage, which is appropriate for most adults. And then our liquid can be used all the way from infancy through the elderly population. In adults, you'd need to take a little bit more to get to that 5,000 IU.
Next up, when we're talking about how D regulates calcium, we have to highlight calcium. And this may be the most obvious nutrient when we're talking about bone health. In fact, 99% of our calcium is stored in our teeth and our bones. And we've seen in studies that calcium supplementation can prevent bone mineral loss or support bone mineral density. Now, when we're looking at calcium supplements, there's a whole array of different forms out there on the marketplace. And unfortunately, many of these are not bioavailable or easily to be assimilated by the body to actually support bone health at all. Some of them may actually increase the risk of calcification of our soft tissues, which could increase heart disease or other concerns like you mentioned with the kidney stones. So when we're choosing a calcium, it's really important that you're actually looking for a calcium that is in the bone matrix itself. Our OsteoFactors features MCHC, which is derived from New Zealand grass-fed cow bone itself. This matrix of calcium provides unique bone growth factors which support bone density and can actually aid in increased bone health versus just preventing the breakdown altogether. Now, when we look at food as medicine for calcium, a good choice could be a grass-fed Greek yogurt. This is also going to give you a good boost of protein to support that lean body mass, and probiotics, which would be great for digestion, immune health, and mood.
Beyond calcium, another mineral that we want to focus on for bone density is magnesium. We see magnesium able to stimulate those osteoblasts and regulate the function of the osteoclasts, helping with bone breakdown and slowing down that process. And we can see it to help with the regulation of other minerals in the body, including calcium and potassium. In fact, this 4-year study of the elderly population showed that those with higher magnesium intake actually had higher bone mineral density in their forearms and hips. So we want to look at leafy greens, consuming 2 to 3 cups daily. A really easy way to do that is to pop those in that smoothie with your grass-fed whey, and we're going to be good to go. And taking our Relax and Regulate formula, which has magnesium in a highly bioavailable form called magnesium bisglycinate, and it also has inositol in there. Both of those compounds combined are going to help with this bone mineral density piece, but we're also going to aid with a lot of the other things that come along with the aging process, like sleep disturbance or insomnia, like anxiety and insulin resistance.
Our 5th recommendation is collagen. So collagen is going to provide us some grams of protein and can support skin, hair, nails, and gut health. But when you look at our pure collagen, it is going to be superior to those found on the marketplace because we test ours for toxic metals. It's also sourced from grass-fed, pasture-raised cows. And the way that we extract our pure collagen is unique to those other collagen peptide products on the market. Most are going to be delivered in a triple helix bond. This does not allow the bioavailability of unique peptides that can actually support bone health on a biological level. Our pure collagen uses an enzymatic hydrolysis process to bring down small bond peptides. Some unique compounds that we see that are third-party tested in our pure collagen include Verisol for skin health. This can reduce cellulite, enhance skin elasticity, and support hair strengthening and thickness. We also have Forta Gel in here, which supports cartilage tissue, reduces bone and joint pain. And in the constructs of osteoporosis and bone health, we have Forta Bone. Forta Bone has been shown in research to support the extracellular bone matrix via the collagenous effects on bone synthesis. In fact, this study here, which was a double-blind randomized clinical trial, a gold standard when we're looking at research, compared our Fortibone in 5 grams, about a scoop and a half per day, compared to a placebo. And they looked at 180 women that were dealing with bone loss. They saw that over a 1-year period, the women that used the Fortibone enhanced their femoral and spine bone density, confirmed by a DEXA scan.
So a great way to incorporate that collagen on a daily basis would be to add a couple of scoops to your morning tea or coffee, give it a quick blend, or you can dump that right into your smoothie along with your grass-fed whey, your greens, and heck, you could even put your Greek yogurt in there for calcium.
It kind of sounds like we need a bone-building smoothie to add into this channel. So make sure y'all stay tuned and subscribe to the Naturally Nourished channel so you never miss our tips and tricks. Check out how you can make it all happen with food as medicine and supplement support. And be sure you check out in our videos the links that are listed below to the recipes and formulas recommended. Yes, Becky. So maybe we, okay, yes, Ron.
And I go, heck, add some Greek yogurt. Should catch that, middle class fans. Well, heck.
Where are the tongs? I need to clip them first. Okay, sorry.